What is a total triage model of care? Practices need to position eConsult as their digital front door. It is about taking control of their appointment offer. By getting it right, practices will manage patient demand and see improved efficiency. The immediate benefits of Total Triage: it is the easiest model for introduction to a practice. The messages are simple for patients. It improves access immediately. Patients are able to access eConsult and get a response by the end of the next working day. It improves continuity of care. The clinical team can review eConsults received and decide who's the best person to see them, and obviously can determine the appropriateness of an appointment. However, it puts the GPs and the clinicians in that practice in charge of patients that need to be seen. We often hear from GPs, "I've had a brilliant day today. I've only seen sick patients." One key win for practices is that 0 DNAs occur as soon as the eConsult Total Triage model is put in place. Regardless of how practices utilise eConsult in their practice, it is important to understand that there will always be 3 cohorts of patients. Cohort 1, patients who don't have access to the internet or have difficulty, for example, learning disability, blind, don't have a computer that can use speech, language, etc. 2, patients who've tried to submit an eConsult and for whatever reason have been kicked off our platform. And number 3, everybody else. Patient journey is very simple. It's about the comms up front. The more information that patients receive, and we can help that, give you information, letters, content for a website that allow you to send information about the significant change to your system. However, any patients that are calling the surgery, they'll also hear a message recorded by the favourite GP, again advising about eConsult. But remember, some patients won't be able to complete eConsult, and you need to have a process for that. So for practices, the key change for them is that they need to make sure that they have removed options for patients to book appointments themselves, whether that's face-to-face, walk-in, or through any online booking service. This means that patients then, when they call, walk in, are advised that have they got the internet? If so, can they please complete an eConsult? If they say no, they haven't, then that's when the cohorts and how you manage those cohorts 1 and 2, you have to have a process. In terms of numbers, by turning off all other options, you will automatically see a utilisation of your eConsult platform. Practices that are using eConsult are now approaching between 5,000 and 6,000 eConsults a month. They have changed their model of care, they've changed their internal processes, and they're able to see the benefits straight away. But the key message for practices who are looking to embrace this new way of working, it's about being in control.